instead of just taking one pill 3 times a day.
I first met Hilton. He was referred to me by another patient who also did not have insurance coverage. And Hilton had a significant problem with his foot.
These gentlemen were so concerned about me as a person and not just me as a number. They said to me, Mr. Rawls, they said, we care more about your health than we care about the dollars. And they said, continue to come to our office, we'll see you.
Once we started evaluating Mr. Rawls, we realized that his diabetes was very, very poorly controlled. And his blood pressure was way too high.
At the time, I didn't understand what it meant to be a diabetic. Like many people, you hear it, and it's the old people's disease. Or they call it the sugar.
Essentially, if he does not get another kidney, he will either be subject to 3 days of dialysis per week, or he could possibly die.
I would say to anyone who is pre-diabetic or anyone who is just finding out that they are diabetic, that it is important not just to care for yourself, but preventative care is most important.
How can we allow someone who can be a productive member of our society just fall by the wayside because we can't get him a transplant?
I honestly thought what others have thought, which is it'll never happen to me. Even with the diagnosis given, I thought, well, amputation and sickness, those kinds of things that came along with diabetes, or that I had even seen others experience, youth on your side, you think those things will never happen to you. And I am the poster child today for what can happen when you ignore the advice of medical professionals, or not even ignore it, when you just don't do the research that is necessary for these kinds of diagnoses.
It's extremely urgent that Mr. Rawls get a kidney transplant as soon as possible due to his condition. I mean, he's at that point where he is at end-stage kidney disease, and without it, he runs the risk of developing further complications and even death.
My wife is a fighter. While she's not much of a talker, she's doing what a wife does. And she's taking care of me, she's taking care of my baby boy, and I'm quite sure that there are times when it's as scary for her as it is for me. But we pray together and we love each other through this. A family that prays together is a family that stays together. Just as my dad was always there for me, my desire is to be there for both my boys, for my 19-year-old who lives outside of home, and my 2-year-old who's with his daddy every day. And he loves his daddy, and he doesn't know it, but he's daddy's world too.
How can we allow someone who can be a productive member of our society just fall by the wayside because we can't get him a transplant?
If I were meant to leave here, why not die 3 heart attacks ago? Why not die when that first stroke came? I believe, it's the will of God that I'd live, not only live, but that I thrive. And it's important that while I'm going through this, that someone else sees my life as a testimony and understands that if he can make it through, if he can keep smiling and keep sharing the gospel and keep loving people and keep doing for folk while this is going on, then I can do the same thing.
You didn't know that what was meant for my destruction, God was using for my construction.
If he is in dialysis for 5 years, his body will start to shut down, and he could die within 5 years just from being on dialysis.
I'm still a little taken aback that we are in this place. I'm always the helper. I'm always the caretaker. I'm the fixer. And now I'm in a place where the fixer needs fixing.
He needs the transplant to live. He needs a transplant to be an active member of the community. He needs a transplant to play with his young son. He needs a transplant for life.
I want to warn somebody that it is not necessary for you to go through what I go through or what I'm going through. And if I can warn someone to eat right, to change the conversation in somebody's home about how families ought to eat and how nutrition is important, the proper diet, and why it's necessary to go to the doctor, have checkups, and ask questions. They are your medical professionals who are there to help you. And don't be afraid to ask questions or to do some research on your own. It'll be a benefit to you and to those who love you for you to do that.
You know, family support, any amount of fundraising that we can do to help offset any medical bills that he might incur for this procedure. And you know, it's going to be a team-based effort. You know, and all of us need to band together to make this happen. He's such a wonderful human being. I would hate for him not to get this kidney transplant, or for that matter, have a delay in care for his kidney transplant.
At some point, you realize that your life is not your own, and that each of us follows the faith of another. And so, I pray that my life is a compass for somebody else, and I don't think that my time is yet.
I shall live to declare his works. I'll live to speak well of his name. I'll live, gonna give him praise. I shall not die, but I'll live. I will lift up my hands. I'll live, trials